Welcome back here to East Texas Live. Trinity Mother Frances has had an electronic medical record program for many years now, but the health system is about to launch one of its most ambitious programs in 75 years to take that medical record system to the next level. Our friend John Moore with Trinity Mother Frances joins us here this morning to tell us more about it. John, welcome. This is something that's very interesting, going to be really intriguing to a lot of patients there at Trinity Mother Frances. Hard to believe in 75 years since the hospital's inception, we're going to see something that's really extremely innovative for 2012.
When you think about, like when I was a kid, we had the mimeograph machines in school, and you'd take the paper and you'd smell, and all that. And then I remember when copy machines came out, and then computers, and just in my lifetime, the technological advancements are really amazing. And so about 10 or 11 years ago, our clinic division, Trinity Clinic, had an electronic medical record installed, but it was specific to our clinics. Okay? But now we're going to have a system-wide electronic health record. Now, what's that going to mean for you as a patient, or for me as a patient? Well, it's going to mean what they promised all those years ago, a less paper society where we weren't going to have as much paper. It's going to become more of a reality. And so through the MyChart feature of our ConnectCARE, which we launch on October 1st, you're going to be able to get on and make appointments. You're going to be able to check your test results, or a lot of things. But you mentioned 75 years. This is the most ambitious endeavor in our history. It's the largest investment of money, time, people. It is something that we're very, very proud of, and we're going to ask everybody to follow the updates on Twitter. Okay. So our Twitter symbol is the @ and then all caps TMFHC. So if you'll go ahead and follow us on Twitter now, as we begin updating and get closer to the launch, you'll be able to find out more about how you can get on and how you can access it.
Technically, John, Trinity Mother Frances, of course, had electronic medical records. This is, of course, we always hear from the Affordable Care Act about this healthcare mandate. You had that before this mandate, but this is something, of course, that I think a lot of people can probably agree on. This will, in the end, help a lot of patients just be more informed and be able to have a little bit more control over their health care.
Well, and Trinity Mother Frances has been ahead of the curve in a lot of areas of health care. I mean, in the mid-1960s, they were doing pacemakers right here in Tyler at Mother Frances when heart care was very much in its infancy. And the same's true with electronic health records. We've had one, as I said, since the late 90s, the early 2000s. But think about it this way. If you or your family are in, say, Phoenix, for example, and you're traveling and you all of a sudden have to have an appendectomy, for example, you go in, we're powered by Epic. It is the most common software for electronic health records. It is a complete from the ground up built system. It's why we chose it, and more Americans are going to be on Epic than any other system in the country. So if you stop at a hospital and they're on the Epic system, they will be able to get into your medical records with your permission and look at it, see what you're allergic to, see what medications you're taking. They don't have to get on the phone and wait and call the doctor. Everything is right there, so it's going to expedite your care. It's going to be amazing.
It's going to be amazing. You're right, John. So of course, on Twitter at TMFHC. John, always a pleasure.
Please
we really appreciate it. We certainly will. Thank you, John. Come back. We'll see you soon.
We will.
Okay, bye.
Thanks for having me.